welcome to our workshop. I'm getting a bit of feedback, actually. I don't know if Jen and Laura, if you're able to turn your microphones off, if that's what's causing it. Thank you. We'll try and, yeah, that's a bit better. Thanks. Brilliant. So, so this is the workshop that relates to our public mental health programme. And we're going to focus on one piece of work within that programme in particular, which is the development of our conceptual framework, where we're particularly looking at the different determinants of mental health on mental health of the population. Yeah, brilliant. Thanks, Jen. So I know you've just sat through the presentation, probably the majority of people, so I won't go through this again, but just a reminder that I'm one of the co-leads along with Kate Walters and David Osborne, and we've had involvement from all of the different institutions across the School for Public Health Research, and it's great to see some of the researchers who have been involved in different work packages have joined us today. So yeah, so I will just pass straight over to Jen, our programme manager, who's now going to tell us a bit more about the conceptual framework in particular.
Yes, exactly. Thanks, Judy. Okay, great. So taking on developing a conceptual framework was an astonishing amount of work that we've taken on over the last few years. And what we really wanted to do was bring together sources of knowledge from academic sources, stakeholder perspectives and viewpoints, and also policy and grey literature searches. So this has been quite a comprehensive project that's taken 2 years for us to work through. One of our first steps was to start this academic review. This has included conducting a literature search of the published academic literature, and this was led by Olivia Reeves at Cambridge University, and it systematically went through the published literature about the determinants of public mental health. The next step, oh, I forgot to fill in the slide. We reviewed about 25 key papers and reports that were either published by charities or World Health Organization or local authorities to identify what the grey literature was showing in terms of the important determinants of public mental health. So we started with a list from our collaborators who identified key areas, but then we also did some forward citation tracking for that as well. We've also engaged in a lot of stakeholder consultation throughout this process. So you'll be hearing from Laura, who is one of our peer researchers and coordinator in the program. But our peer researchers drew out beautiful mind maps where they summarized from their perspective what are all of the components that factor into your mental health. And this was also repeated at a workshop as well. We also held a large in-person workshop and an online consultation to go through the determinants that we identified, and then also to reframe and reshape them and to help us prioritize. So just to give you a snapshot of what this looked like, the state-of-the-art review identified 56 determinants, the grey literature review identified 46 determinants, and the public mind maps had 56 determinants. These were summarized, and we took out any duplicates for a total list of almost 70 determinants. And this was further distilled down to 48 determinants for our online survey. In total, we now have a 55 determinant list divided across 4 domains: the individual, family, community, and structural. So now that we had an agreed list of determinants, we wanted to make sure that we had clear definitions and also identified interventions and resources. So we had an intern who surveyed some rapid scoping reviews for each determinant to identify a definition, and then also some key literature links, interventions, and resources. One of the priorities when we were trying to summarize the research was to be able to show how interconnected the different determinants are to each other. So we acknowledge that income impacts mental health, but is also impacted by so many other factors. So we really wanted to highlight that in the tool as well. And then the final step was to take all of this information that we've gathered and work with a skilled design team. And I'll be turning over to Laura in just a second, who has developed this interactive web tool and created some beautiful images to try and capture visually the determinants and also create an engaging and accessible way to access this wealth of information. So with that, I will turn it over to Laura to introduce the tool in more detail. And I will stop sharing so you can start sharing. Here we go.
Thanks, Jen and Judy. So yes, I'm going to share, ooh, is the feedback here? I'm going to share my screen so you can have an idea of this tool, and then we will share the link so you can also have a look afterwards. So are you able to see this? Yes, that should work. Okay, let me see if it works as I move things around. Can you see a change of? Yeah, great. Okay, sorry, trying to manage multiple windows. So this is our tool so far, but I do need to let you know that it's a pilot, so it's not the final product yet. This is what we've used. We've had a week of user testing just last week, and we're now working on implementing all the changes and building the remaining material. So what you see here should give you a really good idea of what we've done, but it's not the final product. It's not complete either. So some things will change, as mainly to, not in terms of design so much, but in terms of just making sure that it's as accessible as we can. So we need to increase font size and things like that. So that's just a little note. But I will show you kind of how it works. So this is the welcome page, and from here you can click anywhere on the image and we arrive at the home page. And as Jen mentioned, we've clustered the determinants into 4 levels, but as you all know, these levels and each of the determinants within are connected. So this is just a way that we can organize and make it accessible, because 55 determinants is a lot, but it's not to say that they're separate. So you can see with the image here, we've tried to really show how overall everything is part of the same ecosystem. So things are color coded. You can see the individual level in red, family in blue, and community in orange, structural in purple. Of course, public mental health is so complex, we can't show everything in a single image, but we tried to make it as comprehensive as we could within a single image. So from here, you might be interested in looking at what determinants, what factors influence public mental health at a structural level, for example. So you might click on structural, and here you would have the 4 groups of determinants within which there are several determinants. So a few in each of those. Then maybe instead of wanting an overview, you might be particularly interested in a specific determinant. So I'm going to go back to the home page and say you're interested in bullying. You might look at the individual level and then look at the group of determinants. And under trauma and adversity, you can find that one of the determinants is bullying. So you can click on here. You would have the group image here, the determinants in that group, and then we would go to bullying here. And then this is our final card where you have all the information relevant to bullying. So it's meant not as something that has absolutely everything, but it is the key different elements that can essentially send you towards where you might be interested to look forward, to look further. So you've got the definition right here at the top left, then key literatures and interventions, currently there's one key one, of course there are others. You can click on each of those as well, there are links. Then you've got helpful resources if you're really looking for something, if you're struggling with bullying or someone you know is struggling with that, here are some helpful resources. Then on the top right, you've got insights from lived experience. So all people who speak about what it is to be bullied, for example. You have a text and a video that you could click on, and here you've got the connected determinants. So we don't have enough evidence to be able to sort of draw strong links between each of the determinants. Some have evidence, some less so we couldn't do that in an evidence-based way across everything. But we wanted to still emphasize that things are connected and don't function in silo. So we have our suggested connections here, suggested determinants. So you might click on adverse childhood experiences, for example, or media, wherever you might go. Then the final element that we have here is this symbol, which is to signify it's a risk factor for mental health, because of course some determinants are risk factors, some protective, some both. We will improve this because in our user testing, we've seen that people were not quite sure what this meant, so we will be more explicit about that. But once you click on it, you arrive down here and you have a little bit more information, depending on the determinants, and we have more or less here, and a list of references as well. So that's an overview of the tool, and I'm just going to go through a few more examples. And that's it. And if you want to help, you can click here. But this again will be this will tell you how to use it. Okay, I think that's a recap. Just so you know, I'm going to share the link now. Not all pages are linked. Not all determinants are available yet, because this is just a section, a little part of our tool.
Thanks.
Just put the link to the website in the chat. So if you are interested, you can go to that. And then what we're going to also put up right now is a link to a Myro board. So I'm not sure if you have used Myro before, and it's an interactive tool for us to ask some questions and to get feedback. You're able to look at what other people are saying and also respond to those questions as well. So I think that I can share the Myro board, but this did not go super smoothly, so let's try that. There we go. Okay. So you can see a number of you have clicked on and joined us in the Myro board. And for the workshop, we'd really like you to have a click through the website and then thinking about some of these questions. So to start, for example, just overall, when you look at the tool, do you find this tool relevant and interesting? And do you think you would use this tool? So thinking about, would this provide you with useful information for you to use in the future, either for your own information or in your work? The way that you can add to this, you could just double click on any of the sticky notes and you can add comments there. You can zoom in and zoom out to see where other people are making comments. And then you also can react to a comment. So if you agree with someone's comment or question, you can put an emoji on it and you can see reactions as well. So I recognize this is our first workshop of the ASM, and this might be a new tool for everyone to use as well. So give you a few moments. But I was wondering if Laura, if you wanted to maybe walk through a few of the determinants in more detail as people are starting to explore.
I just wanted to note first, I don't know if I missed it, Jen, but at the bottom right, if you're not familiar with Myro, you can choose how you zoom in and out and how to navigate, because we can get lost in Myro. Just wanted to remind this to people, because I can see people working in different places.
So you can, yeah.
I'm not sure if I'm going to make it even more confusing if I talk too much whilst people are reading and answering the questions. But maybe people can let us know, actually. You can let us know in the chat if you'd like me to talk you through more.
Okay, it does sound like there is a problem with the feedback. So I'm going to, we'll just need to be very aware of alternating between muting. So sorry if any of that information was lost.
Has the board disappeared? Have you stopped sharing it, Jen?
I can reshare. I'm not sure what is the most helpful thing to share right now.
Oh, okay, sorry. So you did.
If people have Myro open on their own screens, then it's a lot more accessible because they're able to zoom into what they're interested on commenting on. Or we could share the actual website and talk through, or just, give everyone a few minutes to just explore the tool and give us some feedback and thoughts.
Thanks, that sounds good. So let's give it a few minutes, and if people are having problems, feel free to say something in the chat. And just to note, I know there's been at least one question in the chat, so we will have a chance to pick up on questions people have at the end as well.
It does seem like there are some difficulties with the Myro, so I'm going to reshare, and then we could maybe point out a few tips and tricks. Okay. So when you go to the Myro link, oh my goodness, look at all these people. This is so cool. You can see there's a whole, if you zoom really far out, you can see where everyone's cursor is. And there's a lot of people lingering to the right of the screen. We did outline a few specific questions. So if you are to zoom in, then you can see these questions. But as Laura mentioned as well, you kind of have this box on the bottom right corner of your screen, which shows you where all of the content is. So if you're really lost, then you can just click on the bottom right corner, and that will bring you to a different part of the page. Okay, hopefully that's helpful. So some of the other questions that we're hoping to get some feedback. So as Laura mentioned, we did do some guided user testing sessions a week ago, and they were really helpful in pointing out some ways that we can make the tool more accessible, more useful and relevant. So if you have any overall suggestions or comments, ways that you think we could improve the tool, please add any comments to the board as well. And then we're also interested in having a broader conversation about what might be missing or where can we go from here, especially in light of the pandemic. So when we started this work, this was before COVID was on any of our minds. And the pandemic has really highlighted how so many of these determinants and factors really do have a major impact on our mental health. So are there gaps that aren't fully captured in what we've shown today? And are there things that have emerged in the past year that maybe we could discuss in more detail in the tool? And I hope that Judy and Laura, you've been able to see some of the comments and maybe guide us through a few of the themes that are coming out.
Yeah, I mean, I'm making a note of a few things. I might just give people a bit longer because I think everyone's on the hang of it now. So
if you do have something to say that doesn't fit within these categories, you can feel free to post-it notes elsewhere with your comments, questions, queries. We will find them.
So there's lots of positive comments, which is great. It's kind of it's a neat way to be able to access everything.
Just see one question in the Myro. which is on who is our intended audience. So I'd like to answer that. Just we have 3 audiences in mind, particularly with one academics who are working in this field, and also another which are public health professionals and practitioners, and a third one which is the general public. So we've tried our best to sort of make it, because these different groups have different interests and different needs, so we tried to make it relevant for all these audiences as best as we could.
Thanks, Laura. And actually, there are a couple of other questions. So there's a question that of the areas of blank, which I think is because it's still a work in progress. Is that right? Does anybody want to say more on that? So, for example, the structural commercial determinant.
Mm-hmm. So there's 2, sorry, Jen. There's 2 types of blank. So there's one which, if you try to click on a button and it doesn't get you anywhere, that is because it's not currently accessible, because we're still working on it and haven't published it. We've published just a small part of it. There are other blanks in certain determinant pages where there's missing there's a block where there's no links, and that's because we don't always have all the information for each determinant. So some determinants have much more literature, for example, than others.
Also a really good point. So we've tried to very quickly through huge amounts of literature, huge amount of resources to summarize what is most relevant for this. But if you're aware of something in that second type of blank where we might not have an intervention suggested, for example, or if you know of a key resource, feel free to pop that also on the board or in the chat, because then it's something that we could still potentially add to the tool as we're still finalizing the content. And for those of us, I see that there were a few people that joined a little bit later in the session. I'm just going to reshare the links. So just to let everyone know, we are looking at the new publicmentalhealth.co.uk site, which is bringing together very broad list of determinants of public mental health. And so the task right now is everyone's just clicking around, exploring, trying to discover what's all contained. And if for specific comments or things to add, we have a Myro board, which is what you see on the screen share right now. And you can see different participants are adding comments under the questions that we've posed. So asking if the tool is relevant, some suggestions or comments, and then also thinking about what this might mean in the COVID and post-COVID landscape. So if you do have questions or you're a little bit lost, just let us know and we'll try and find you.
Thanks. And also just following on from what you were saying just before, there's been a question about how we're going to update this, which I guess links to that point that, you know, that there might still be evidence out there that we haven't captured, or obviously there'll be evidence that comes to light as time goes on.
It's actually a really important but challenging question to answer because the public mental health program funding does come to an end in the end of March 2022. And we currently don't know in terms of the funding or for continued updates and improvements to the site and how this will be kept refreshed. So that's a conversation that we're still having within the program and broader to see what happens once we launch the tool. How do we keep it useful and updated? So if you have thoughts and questions about that, please let us know.
A few practical things that I can see between the Myro and the chat. Sorry for missing things, by the way, and thank you also for all the good comments. Someone is saying that there is no back button, so we can't put a back button because we have no way of predetermining what is the previous page people will visit, but we will put back buttons to the determinant groups and to the levels, so that will hopefully improve things in the final version. For now, just use the back button in your browser instead. I also see someone mentioning that the text is small. So yes, as mentioned, the fonts will be increased, the sizes will be increased. So there's a transfer issue between the design and the site, so that will be improved in the final version.
Thanks. There's quite a specific question about where body image is. I don't know if either of you know off the top of your head where that is, or if anybody that's in the tool has seen it anywhere.
So we ended up, as you'll notice, there's a lot of grouping. We ended up having to group many different things kind of in broader categories just to make the information manageable. So I don't believe, and Laura can correct me, I don't believe we have body image as a specific and separate determinant. I think we've included a very broad physical health and also some aspects of self-image. But maybe Laura, maybe you are best placed to speak to that.
Yes, exactly as Jen said, we've had to cluster things together, otherwise it would have unmanageable list. So body image, I think, is in the sense of self, and there's different parts, different components to that. So because those pages are not yet accessible, you would only see the top title rather than the breakdown. And hopefully that will be better when you've got all the information.
But that's a really good point in terms of any emerging factors, anything that you think that we've completely missed or that is that should be appearing and you were expecting to see it. One of the other things that I wanted to touch on before letting Judy or Laura take another question is it was really difficult to decide which domain something fit in. So for example, when you think about bullying, it might be an individual experience that an individual experiences, but a lot of bullying happens in the family or in the community in terms of school environments or work environments. So deciding to put it into individual was really difficult, but we needed to have one place for each determinant, but acknowledging that it's multi-level, many of the indicators could have fit in a lot of different places.
Thanks. There's a couple of comments about where it could be used. So I've seen a comment about maybe in local authorities, and somebody else has mentioned getting schools involved. And then kind of relatedly, there's a question about what the strategy is for kind of getting it into practice. So, I mean, you two have probably got thoughts on that as well, but, I guess it's partly going to be through doing things like this, through kind of, presenting it, spreading the word. And we're going to mention at the end, but I can flag it now that we do have, within the public mental health programme, we do have a network that people can sign up to, which is one of the ways that we try and share all the information about the work that we've been doing. But if people have got ideas about other ways that we can share it, we're really happy to hear about that as well. And please do spread the word.
Yeah, absolutely. And to add to that, we do have an advisory group as well that includes some practitioners and people from local authorities and from PHE. And we also have been working to reach out to other networks, either practitioner networks or researcher networks as well, to try and have connections to other places. But it's very challenging to, we're really interested in making sure that this tool is useful and then it's also used. So we've received some positive feedback from our practitioner partners, but again, if you do have suggestions of how we can get it out there, and that would be really helpful. So we do have a few questions in the chat as well. So one of the questions from Deborah is, if you're aiming at the general public, what do you expect them to do with the information and how does this help them on their journey? Laura, did you want to answer that one?
Yes, so there would be different, of course, different interests, but we've worked with a lot of people who either identify as having lived experience of mental health issues or who are general members of the general public in one sense or another. And from feedback, we know that some people just want more information. So sort of knowing where to go is sometimes a big barrier of where to start, where to look. So with some key literatures, key starting points, that's really helpful to get information in that sense. But also a lot of people want to know not about the science, but about how people are experiencing a certain thing, which is why we've included the lived experience insight, which we think is extremely important. Now, data is one form of knowledge, but lived experience is another, and they really should come together. So that's been important, the lived experience insights, but also the resources. So as I mentioned before, if someone is struggling with bullying, then they would have a good starting point of different resources they can access to get support. So those are the different ways in which we think members of the public might be interested to use this tool.
Add to that, I see that Deborah has a few follow-up questions about local and what local means. So because this is a tool that we've developed for all of England, a lot of the resources that we point towards are more national in nature, but potentially this tool could be picked up by more local authorities or charity groups, and they could connect to more local resources as well. I did want to also, I see that we have a question from Alan. And he mentions that it's sometimes useful to have use case scenarios. And actually, I can turn this one back to Laura as well. So Laura has been involved in this project from the very beginning, but she also is a very talented graphic artist and designer. And so her and her team have developed user journeys. So I'll maybe turn that over to you to respond to that question as well.
Sorry, I was reading Myro. Which question is this? Oh, the case scenarios. Yes. So yes, indeed, we've done case scenarios for lots of case scenarios, including academic individuals and public health professionals and members of the public. So we've used these in the design, and we are still using them for. There will be quite a few changes and improvements in the tool, and we know that navigation and just the way things are communicated needs to be as clear as possible. And sometimes, as visual people, we really need to get this right to think about people who are not as visual. So we've got lots of plans of how to improve that. So yes, I don't know if that answers the question. I'm trying to keep my eye on the chat if you have follow-up questions.
Well,
I can also. Sorry. Go ahead, Jen.
Oh, I was just going to pick up while I was waiting to see if Alan came back on that. I was going to pick up on a question from Ashley about is this going to link to the outcomes measures work? Yeah, and how that's going to happen, because I know some of this work did begin quite linked to the outcomes measures in Work Package 2. So some of the other work in the wider programme.
Yeah, so thanks to Ashley. So we do have a separate package, a project that's really focusing on how we measure the outcome of public mental health. And that is still ongoing. There's still several more months of that project. They've identified several different things like well-being, which includes things like flourishing, languishing. I did see a comment about that. And symptoms of mental health problems, social connectedness. Part of the reason why there was a lot of overlap, particularly in the beginning, is because some of the outcomes are also determinants. So you can think that a mentally healthy population might be one where there's a lot of positive social connection. There's like low symptoms of mental health problems. But then you also might think that social connectedness is one of the determinants, and whether or not you're socially connected, it determines your level of mental health. So it's a very complex puzzle to piece through. For this tool, we don't actually have the outcomes represented on it because the outcome work isn't finished. And again, this is part of the longer term sustainability questions that we're having in terms of how we would bring that information in as well. So that's still a question, but in terms of the tool, we've been really focusing on the determinants rather than the outcomes.
Just another quick practical thing. I see someone say that it would be good to have a graphic indicating where we are in the structure, and that's in our plans. So yes, we realize it's quite a big tool. So we will add a location of where you're at and the ability to go back to the previous group or previous level to make it a bit easier.
Great, thanks. In terms of whether there are any gaps, or whether either of you know where this might be, if it's in there already. There's somebody asking about chronic strains and stressors, and where that might be. I think they've looked into trauma and not seen, which is, yeah, interesting question. So something about that kind of accumulation of strains, I guess, over the life course.
I think that it has been embedded in a number of the different indicators when you go into the details. So when we think of sort of chronic exposure to strains and stressors, one you might think of is chronic exposure to financial insecurity or housing insecurity, for example. So we do have indicators around like financial insecurity. And then within that, there's this idea of the chronic exposure to those sorts of things. Similarly, as you've been able to explore the adverse experiences and traumas, that is one of the sources. So we don't have a separate indicator that's chronic stress, but I think that it is captured within some of the detail of many of the different indicators. I do see that there are a number of issues that have been flagged in the what sorts of determinants might we want to consider more fully. So there's a few that have mentioned green space, and I did want to mention that we do have that in the structural, we have a built and natural environments area. I just don't think it's fully populated yet, but I think that that's a really important one. And thinking of the theme of Mental Health Awareness Week this week around nature and access to nature, I think that's a really important thing to consider. And we also, and one of the other things, and again, it just might not be fully accessible yet, access to mental health services, which has been a huge topic of conversation during the pandemic. And we do have a section in the structural piece that is about systems, and that is there's one on mental health or health and social care, criminal justice, and the different systems, and whether they're accessible, high quality, appropriate, culturally appropriate, those sorts of things. So that's there as well. I'll see, Laura or Judy, have you noticed a few other comments that you want to talk to?
There's another question in the chat actually from Emma, which is about the tool linking to evidence to sort of help, as people are using the tool, think about what the recommendations or implications might be. So I guess we've spoken to that a little bit in terms of drawing on the literature reviews that we've done, and it also relates a little bit, doesn't it, to kind of ongoing updating, because actually a lot of the work that we're doing still in the public mental health programme is going to generate information about interventions that are effective. I don't know if there's anything, Jen or Laura, you want to comment on that.
Add to that. This is possibly the piece that's been the most hidden, but that the designers will be bringing out a little bit more, is that we do have some links to the specific evidence as well. If you're on a determinant card and you see that central image, there's a little symbol to the right there, and that will pull up a list of that has a little bit more in-depth information and links and references. So that's one of the ways that we've been trying to get detailed information that would be really useful for academics and researchers or people that are working in public mental health, but not make it too overwhelming. So there's a section that you can expand, and that's has some key references in it. And I think that that's currently a little bit hidden in the tool, but will be more obvious in the next version. This is a beta.
I think there are lots of nice comments on the green section now about I guess not necessarily so much what's missing, but what's likely to be very important in the post-COVID landscape. So, I mean, that's really helpful for us to see those thoughts there, you know, around things like employment and the school environment, some of the kind of fears and concerns that people have developed about isolation, going back out, having something to look forward to. So I don't know if anything jumps out that I think from my memory, a lot of those things are in the tool already. We can kind of go through those and make sure that they are all in there. Because I think it's really important, isn't it, to kind of think for the next few years about what's going to be most on people's minds and most important in terms of determining mental health.
This isn't a specific comment, but I have just been loving watching all of these cursors flock around Myro and see where the comments are. It's been very cool to see the tool get to this point as someone who's been really heavily invested in it for a number of years. It's great to get the positive feedback, but also the suggestions or the ideas for how it might be useful or how we can discuss it with partners and stakeholders so that we can make sure that it does have the impact that we hope for. So I did want to thank everyone for that. So this session is only 50 minutes and it was quite free flowing, but I think that Judy, you have maybe a few wrap up things that you wanted to summarize. And so I'll turn it back over to you.
Thanks, Jen. Yeah, I mean, according to the programme, we've got till 3 before refreshments. I mean, I guess people can carry on having a play, but and that's a good point. If people need a comfort break, we can wrap up formally. I think Laura's going to tell us if there's anything else to say about the next steps for the tool. I know we've touched on some of that already, but do you want to say a little bit more, Laura, about?
Yeah, thanks, Judy. So as mentioned, we've done user testing, we've gathered all the feedback, synthesized all of that, and we are now going to capture all your comments that you've put in Myro and in the chat, and essentially just bring all of that back to the design room and integrate them as best we can. As you know, sometimes feedback is conflicting, people have opposite opinions sometimes, so we'll do our best to really bring all that into the tool. So we will add and edit and improve things, and then build all the final tool, really, all the final materials, and we are going to launch it at the end of June. So at this point, it would be fantastic if you can all have a look at it and share it and use it in whatever way works. I think if you sign up, I mean, Judy will let you know, but I think the easiest way to get to know when this is launched is via the newsletter. But thank you all for your comments. I know it's a bit confusing to go through. I was confused myself to go through the Myro and the site and the chat. So thank you for bearing with us. Your comments are really, really helpful. And thank you for the very, very nice comments, as well as the very, very good suggestions.
That's great. Thanks, Laura. Yeah, just to echo that, it's been really, really. I think there's been some really sort of helpful questions already for us. So thank you for joining in. We have got a little longer, so do carry on having a play, and we can sort of still be here answering any further questions. But just to say, so we've mentioned the Public Mental Health Programme Network, and I think we'll put that in the chat, the link for that in the chat. So you're all very welcome to sign up to that if you're not part of it already, and that's definitely a good way of hearing about the launch of this framework, as well as other things that we're involved in. And I guess the other thing is, if we've missed anybody's comments, and also perhaps more importantly, if people do have ideas about how we can start sharing this when it is launched, how we can get word out there, different ways that it could be useful, then we can keep that conversation going. So we can also put the email address perhaps for the programme in the chat. Oh yeah, so the link, so Jen's put a link already on how to get onto the network, which is where the newsletter comes out from. So Deborah, hopefully that answers your question, if you can see that link in the chat. And then we'll also add the email address in a minute if people want to carry. There we go. So the email, thanks Jen's gone up there as well. So if people want to carry the conversation going, if things occur to you that we haven't covered, then yeah, please come back to us.
I've also posted a link in the chat for a feedback form, and this is if you still are thinking of the tool after you've left the session and didn't get a chance to put it on a sticky note. We do have a Microsoft Office form that you can contribute more detailed feedback as well. So that is also in the chat. And yeah, I think that's it from me.
That's great. But I mean, I think people are still on this. Keep going a bit longer.
Just remind everyone in terms of the next step, what happens next in the session or in the program. You want to go through that, Judy, or shall I?
Yeah, don't mind. You, great minds think alike. That was just occurring to me as well.
Great. So as we see the numbers are starting to dwindle, I hope that means that most people are finding their way back to the main session. So we are now going into a refreshment break. And this, as all of the refreshment breaks throughout the ASM, is a chance for you to go to the expo and to check out some of the pre-recorded sessions from our pre and postdoctoral fellows, our FES projects, and also a chance for you to maybe get up and get away from your screen just for a moment and have a bit of a comfort break. And there's also networking sessions. And you can also attend the session at 4 p.m. with the fellows and the FES project researchers, because you'll be able to interact and ask any questions about the research they've presented. So that is, I think, it in terms of our session. Thank you so much for participating and for providing us with these really helpful and important comments. We look forward to going through them in more detail and really look forward to having you use the tool once we have the final launched version in June. So thanks again.